So let's hit next on scleroderma. Sclero means hard, derma means skin, hard skin. And scleroderma could be classified into different ways, whether it's localized or whether it's diffuse. And there are in children and in young adults forms of scleroderma where it only affects one patch of skin. So we call that morphia. And then if it affects a child, and if it's linear, we call that linear scleroderma. And sometimes linear scleroderma can affect the scalp, and it looks like a blow of the saber, a coup de sabre is what we call it. And it affects not just the skin, but the underlying bony structure can affect the soft tissue as well as the brain. So we always worry about these patients, particularly in younger adults, whether or not they have any underlying structural abnormality of scleroderma. It's not just with the skin. Now, the scleroderma that you all are probably familiar with consists of primary systemic sclerosis. So CREST, so that it includes limited scleroderma, or diffuse scleroderma, so systemic sclerosis, where it involves the whole body, internal organs included. So with CREST syndrome, that stands for calcinosis, Raynaud's, esophageal dysmotility, sclerodactyly, as well as telangiectasia. Now, just because you have CREST can appear in limited disease, all 5 symptoms, or it can also appear in diffuse scleroderma. So patients with diffuse disease can also present with Raynaud's, calcinosis, esophageal dysmotility, telangiectasia, and sclerodactyly. So it's not necessarily only confined to the limited disease. Now, there are also scleroderma-like illnesses. So these are the differential when you see somebody coming in with thick skin. So patients who've been exposed to bleomycin, patients who might have had eosinophilic fasciitis. So eosinophilic fasciitis is where there's a localized condition where there's inflammation, intense inflammation in just one area of the skin. Then it scars over. If you do a biopsy, you see a lot of eosinophils. We leave that condition alone. We don't necessarily have any specific treatment for them. But they could have peau d'orange skin, where basically their skin looks like that of an orange. Then there's also nephrogenic systemic fibrosis. So in the last few years, you've heard that if patients have renal insufficiency, be judicious about using gadolinium contrast, particularly when ordering an MRI, because we've been seeing quite a few cases of this in patients who are on dialysis, and then they develop this thick, hardened skin in their feet, in their arms, along their belly. It's irreversible. Okay, so that's gadolinium related. With L-tryptophan syndrome, so this is a condition back in the late 80s, early